Diabetes. In the year 1552 BCE, an Egyptian physician named Hesiare made the earliest known record of a strange disease. Later records from various cultures also describe the same disease, and how its sufferers would pass great quantities of urine and slowly waste away. It was also observed that the urine of the afflicted was sweet, as reflected in the Chinese name for the condition, Tang Niao Bing, or sugar urine disease. This disease, which is estimated to affect over 30 million Americans today, nearly 1/10 of the whole population, came to be known as diabetes, from a Greek word meaning pass through. It was not until the 20th century that the cause of the disease was finally understood. It was found that healthy individuals produce a hormone called insulin that helps the body metabolize sugar in the blood. In some people, however, the cells that produce insulin die or are inefficient. Without insulin, the amount of sugar in the blood remains high, and this in turn leads to the various symptoms associated with diabetes. It was quickly determined that there were two main categories of diabetes, both linked to genetics. Type 1 diabetes, which usually develops in children and young adults, is now understood to be an autoimmune disease in which the body attacks and kills its own insulin-producing cells. What triggers this condition, however, is still debated. There is some evidence that a viral infection may be the cause, while others point to allergic reactions to certain nutrients such as gluten. Whatever the cause, sufferers of type 1 diabetes can manage the condition with daily injections of insulin. The second major type of diabetes, type 2 diabetes, accounts for approximately 90% of diabetes cases. This form of the disease, which generally appears later in life, involves reductions in both insulin production and sensitivity. Although genetics also play a role, type 2 diabetes is primarily related to lifestyle. By far the main factor contributing to its onset is obesity. Other factors which make a person more susceptible to developing this form of the disease are high-sugar diets, a lack of physical activity, and stress. As a result, the symptoms of type 2 diabetes can often be controlled or even eliminated by a change in lifestyle, though medicine is often used as well. For a long time, type 1 and type 2 diabetes, along with a related form that sometimes affects pregnant women, were thought to be the only variants of the disease. Recent research, however, has found that cases of type 2 diabetes can in fact be subdivided into 5 distinct types, each genetically distinct and with its own characteristics. To date, all patients diagnosed with type 2 diabetes have been receiving similar treatments for their conditions. This discovery suggests that a wider variety of treatments is needed, and doctors should prescribe the most effective form of treatment for each variant of the disease. A good example of how this discovery may help patients is related to the two most severe types, called severe insulin-deficient diabetes and severe insulin-resistant diabetes. Traditionally, from a treatment perspective, these two conditions have been regarded as essentially identical. It turns out that although the two conditions have similar symptoms, they should be treated in very different ways. In the past, sufferers of the first type, severe insulin-deficient diabetes, were often prescribed a drug called metformin. These new findings suggest that metformin will not work well for these patients, and they would respond best to insulin injections, just like those with type 1 diabetes. In contrast, patients with the second type, severe insulin-resistant diabetes, respond well to metformin. It is estimated that in addition to the 30 million Americans who currently suffer from diabetes, a further 85 million have a condition known as prediabetes. As the name suggests, those who show symptoms of prediabetes are in danger of developing the disease in the future. Thus, the end for continuing research into the disease is as important as ever. Current and future areas of investigation include trying to identify the genetic basis of each form of diabetes. Scientists are also looking into the distribution of the different forms of the disease among barriers populations. This new knowledge will help physicians prescribe the most appropriate treatment for each diabetic patient.